Okay, hello everyone, and welcome to our DBGM's presentation of Elderly and Alone, LGBTQ plus people of color during COVID-19. Our panelists who are presenting this evening are Dr. Wilhelmina Perry, Carolina Hoyas from the Department of Aging, Aundaray Guess from the Griot, and Kyaien O, Professor Kyaien O from the University of South Florida. I'm sure, as many of you will appreciate, that our elderly, we live in a very youth-focused environment, a very youth-focused community, which is something that began roundabout, we can say, with the modern era, where everything is focused instead on the youth and young people. And what we've discovered and seen recently is that more and more of our elderly, the seniors in our community, are being pushed aside. They are being marginalized. Seniors and elderly in our communities have been struggling with a number of issues pre-COVID-19. So pre-March 1st, we in our communities have had issues that we've been struggling with. But we recognize that with COVID-19 and the restrictions imposed by it, that even more of us were subjected to a lot more stringent impositions and curtailing our movements, our efforts, which led many of us to feeling even more isolated and alone. What we hope to be able to do is to, with this presentation this evening, is to discuss the many ways in which our elderly are affected, our elderly members of our communities, their mental health are affected, and how they are coping, how they are providing, how they're taking care of themselves. But before we do that, I'd like to ask us to come to a couple of agreements. One is, please keep your microphones muted. We ask that no photos be taken of the screen because some people may not want it to be revealed that they're in this kind of forum. We ask you to be respectful of others on this forum, even if you disagree. And we will use a chat box at the top right hand of the screen for questions. Please leave your questions in the chat box and indicate if for a specific speaker or if a general question for everyone, and I will read it out. At the end of this forum, we will share the slides and the recording with everyone. So just before we begin, I'd like us to take a moment in silence to think about those members of our communities who have gone on, who have died from police violence, from suicide. And for those of us here in New York, I want to call special attention to two people that I can remember clearly who recently died from COVID-19, Sojourner Macaulay and Norman Green. So I'd like us to spend a moment in silence. Thank you. I came across a poem that was shared on my Facebook page by Charles King from Housing Works. And he shared this poem by Maya Angelou on aging. When you see me sitting quietly like a sack upon a shelf, don't think I need your chattering. I'm listening to myself. Hold, stop. Don't pity me. Hold. Stop your sympathy. Understanding if you got it, otherwise I'll do without it. When my bones are stiff and aching and my feet won't climb the stair, I will only ask one favor. Don't bring me no rocking chair. When you see me walking, stumbling, don't study and get it wrong, 'cause tired don't mean lazy and every goodbye ain't gone. I'm the same person I was back then, a little less hair, a little less chin, a lot less lungs and much less wind. But ain't I lucky I can still breathe in. Maya Angelou. So community members, I have the honor this evening to present Carolina Hoyas, who is the Director of Caregiver Support at the New York City Department for the Aging. She received her bachelor's degree in Sociology and Urban Studies from Fordham University and a master's in social work from Columbia University. For 18 years, she worked with the family caregivers of older adults and community members struggling with dementia, both in practice and research. Community members, I'd like to present to you Carolina Hoyas, and she will talk to us about aging during a pandemic and providing resources.
Hello, everyone. Thank you so much. I'm grateful to be here. Thank you, DBGM, for this invitation. And I'd like to share greetings from our Commissioner, Lorraine Cortez Vasquez. Let me share now my presentation. Please let me know if you can see it. Can you see it now?
Yes.
Okay, great. So the Department for the Aging has been doing a great deal of work during this pandemic. And I'm just going to go through some of the highlights, some of the work that's been going on within the Department for the Aging and our community providers, but also talk about some of our programs and what's available and how we're helping older adults to ensure that they're doing well and that we're reducing social isolation and loneliness among them. And so DFTA Move Forward. DFTA is the acronym for the New York City Department for the Aging. And so the Department for the Aging, during this crisis, our mission has remained steadfast. And really, it's been ensuring the health and safety of older New Yorkers with food provision, combating social isolation are among our top priorities. And with our program sites being closed, DFTA and the network of providers really worked on converting in-person services to services virtually being delivered. And so this happened across many programs, not only our senior centers, but also through our geriatric mental health, friendly visiting, caregiver, case management, HICAP. And I'll talk a little bit about those programs and how they've been working and helping older adults during this time. Currently, the Department for the Aging and its providers are conducting on daily average about 7,000 wellness check-in, social engagement and case management calls to older adults. And these calls are really important because it allows these older adults to stay connected with the programs in the community that they know and identify any needs that come up. So when the first stay-at-home orders started, it really became crucial to know how older adults were doing and connect them to the access of services that they needed, whether they needed medications being delivered, food being delivered. And so that really became essential for them. And so in our efforts to combat social isolation, currently, 171 of our providers are currently offering virtual programming like exercise classes, concerts in motion, arts and craft workshops, comedy workshops, and this is only within our senior centers. Our centers are providing this virtual programming in about 14 languages. And so we understand the diversity of New York, and for that, our providers have stepped up and are offering these activities in multiple languages. We also rolled out recently a PSA campaign that raises awareness about social isolation. And on the radio, it was voiced by Broadway star Lin-Manuel Miranda. And so that really, garnered attention and increased the interest of New Yorkers to get involved with the Department for the Aging and find ways to help reduce social isolation among older adults. In April and May alone, more than 16,000 older adults connected with DIFTA programs participated in virtual programming. And we understand that in order for older adults to connect to virtual programming, you also require the technology, right? The devices to be able to do so. And so the city provided 10,000 tablets to older NYCHA residents, and the tablets came equipped with Wi-Fi equipment. We partner with an organization called OATS, Older Adults Technology Services, and they provided a step-by-step manual to older adults on how to use those tablets. But they also have a platform called Senior Planet where virtual programming is available. And so these 10,000 older New Yorkers that are NYCHA residents are now able to access and be connected virtually because of this initiative. So we're very happy with that initiative. Another campaign that we rolled out is the Open Up Puerto Rico campaign. And we really rolled this out because we wanted to create and raise awareness about anxiety and depression and connect LGBT older adults in New York City and Puerto Rico to counseling and mental health services. As many of you know, Hurricane Maria hit in 2017, and the lingering effects of this event, of this natural disaster, have continued to impact Puerto Ricans. And so currently about 3% live with no electricity, about 18% still reside in damaged homes or are living under blue tarps. And SAGE Puerto Rico, this organization held focus groups where they learned that a lot of the LGBTQ older adults in Puerto Rico felt isolated, felt alone, felt they were not respected or valued in their communities. And so the Department for the Aging partnered with SAGE Puerto Rico and SAGE New York and rolled out this campaign during the month of June, Pride Month, and made accessible the Puerto Rico, a local hotline, and also a hotline here in New York City through SAGE USA, where individuals could reach out for help. And they could, speak with someone, get connected to mental health services. The ads were placed on Facebook. They were placed in English and Spanish. They were run in radio and local newspapers to ensure that the information was shared widely. And so here are some of the ads. I love these ads. They're very colorful. And so these are the ads that were shared during this campaign. And so really the goal of the campaign and what we were trying to accomplish was we hope that the older LGBT community in Puerto Rico and both New York knew that they were included, that they're respected, that they're loved, that we wanted them to know they're not alone, and that our services are here to support them during this pandemic and ongoing. And so that's one of the things that we've done recently. We also have a geriatric mental health program that targets social isolation and loneliness. And as you know, social isolation is about, it's objective, it's the lack of social contact. And loneliness is subjective. It's about the feeling of being lonely. And you can be alone without necessarily feeling lonely. However, in our country, before the pandemic, there's been an alarming large number of older adults that have been isolated and lonely. And so both of these are associated with increase in heart disease, increases in mortality risk, and it's on par with smoking, obesity, and physical activity. So it really is very damaging to the well-being of older adults when they are socially isolated and lonely. And COVID, and the stay-at-home order obviously contributed to making matters much worse for them, in part because their usual routines, where they shop, where they went to congregate, to have meals together, to socialize, to walk down the street and see their neighbors, see friends, was no longer there. And a lot of that uncertainty of the changes that came about because of COVID and the social distancing and the stay-at-home orders, really what it exacerbated was the risk of depression and anxiety among older adults. And so these geriatric mental health programs are really key and essential to ensure the mental health well-being of older adults. And what they offered is licensed mental health professionals that are able to assess the need of the individual and provide interventions to those that are struggling. They offer wonderful groups that are for grief and bereavement, which is something that, they are dealing with because of the loss of family or friends to COVID. And so that's been very significant. Also, the services are offered in multiple languages. They offer them in Spanish, Mandarin, Cantonese, Russian, Polish, Russian, and Ukraine. The services are provided currently by telephone or virtually. Prior to COVID, they were being provided at many local senior centers, which is great because it takes away the stigma of individuals not seeking mental health services because of the stigma of walking into a mental health clinic. There's also support and reassurance, and this can be provided on a weekly basis through these phone and virtual visits. There's also engagement activities that are offered, and about half of these mental health service sessions that are happening right now are occurring virtually, which is just amazing. And so we also have the friendly visiting programs that has also taken off, and it's a partnership with City Meals on Wheels. I'll speak briefly about it since our partners from Griot Circle are here and they can talk a little bit more in depth about their program. But really this program, we have 14 of these programs and they serve the 5 boroughs of New York City. And the focus of the friendly visiting program really is to connect homebound older adults with volunteers in their community and allow them to connect at least once a week, either right now by telephone or virtually right now. Before it was in person. The volunteers are asked for a commitment of no shorter than 6 months. And like I said, Griot Circle provides the friendly visiting program for the LGBTQ older adults of color citywide. And this program began at the Department for the Aging in 2017. And since then, 1,500 older adults have been visited by a friendly visitor. And so what we found, which has been amazing and just showing the impact that these programs have, is that after 6 months, 42% of those 1,500 reported a decreased feeling of loneliness, and 54% reported a decrease in isolation. So that's pretty significant. Right now, we have nearly 1,000 friendly visiting volunteers who are video chatting with older adults. And thanks to that PSA campaign that we partner with Lin-Manuel Miranda on, we have received about 139 additional individuals who are now interested in becoming friendly visiting volunteers. And usually when the match is made, what happens is that the friendly visiting coordinator will check in with both the older adult and the volunteer. Both parties agree to a day and a time when the phone calls are going to happen. Right now, because of COVID, they're happening twice a week. And the length of the call really is up to, that match, meaning those individuals and how it is. And the other good thing about the friendly visiting program is that the volunteers are able to report to the coordinators, if there's anything happening, if they notice any difference in the older adults. So if the older adult is changing cognitively or expresses feeling sadder or some other concern, they're able to then raise that alarm and raise that issue with the coordinator, who will then follow up. And so here is a photo of an older adult with their friendly visitor connecting via a virtual visit. And so this is wonderful to see. And so many of these are happening throughout the day and, during the COVID situation. We also have national family caregiver support programs. And these programs, we have 12 of them in the city, and they are targeting caregivers or informal caregivers of individuals that are older adults, people with dementia, grandparents or older relatives raising grandchildren, older adults that are taking care of a disabled adult. And we partner with SAGE, and SAGE serves the city, the entire city, caregivers that are from the LGBTQ community. And so this has been wonderful because many caregivers have been at home working from home, but also taking care of that partner, that spouse, a parent, and they've been overwhelmed. And so this is the variety of services that they're able to receive through the caregiver programs. And if you look at the yellow circle, counseling, support groups, and trainings, that has been significant during the time of COVID to ensure that folks are not socially isolated. Currently, our caregiver programs are providing a variety of at least 35 different support groups. Some of them are bereavement groups. They're being offered in 4 different languages. And some of the trainings are being offered either via telephone or virtually through apps like Zoom and WebEx. And as you can see, the topics vary from anywhere about what older adults and caregivers need to know, to avoiding COVID scams, grief and loss and resilience during the time of COVID, stress reduction, and improving mental health, which has really been significant for caregivers who are working from home, caring for a loved one, but also for the long distance caregivers who were not able to be there because of stay-at-home orders, have been able to access services. And lastly, we also have the Social Adult Day programs. We have 9 of these programs, and usually they would be congregate sites for people who are physically frail or cognitively impaired and who need a more structured environment to socialize and participate in recreation. Since these sites were closed, they have transferred their services to virtual, and they're offering memory activities and music therapy and other enhancements for cognitively impaired and frail older adults to do it virtually. And so these programs have really been essential. And we understand that not every older adult is able to engage via virtual or telephone programming because of their cognitive situation. And so we rolled out a pilot program which includes electronic pets. And so electronic pets, as you see them here, these cats, were distributed to older adults from the Social Adult Day programs, and they're able to engage. These pets respond to speech, to touch, and so the caregiver is able to get respite because they're able to hand over the pet to the older adult, and the older adult stays engaged. And so really a lot of our efforts have been in ensuring the safety and well-being of older adults, making sure that folks know that these services are available for New Yorkers, for older New Yorkers. We're currently working on the Get Cool NYC program, which has distributed and has installed 34,000 air conditioners throughout New York City for older adults with low income, to ensure that since they continue to have to stay at home, they can continue to be safe and well. Here are some resources. If someone is in need of services and it's looking to connect with a Department for the Aging or one of our programs, it's simple. They can call 311 or they can call Aging Connect, and they will be connected to the program that they need. If someone is experiencing food insecurity, they could also call 311 to get connected with the Get Food NYC program. I've also added a link for a virtual senior center. So one of our providers, many of our providers are offering virtual senior center services, and also Get NYC Well, which links individuals to mental health services needed. And so really what we hope and what we've learned during COVID is that our services could be transferred into an virtual and telephone format and still be able to meet the needs of older adults to ensure their safety and well-being.
Thank you very much, Carolina. So our next presenter is hold on. Can you guys see my screen? So all right. So what I'd like to share with you guys is that Carolina did not use all of her slides. because of time. So at the end of this forum, you will all be sent all of the slides that Carolina used, as well as the slides that Professor Connor would use. And so, community members, I'd like you to welcome Dr. Wilhelmina Perry. And Dr. Perry, yes, I'd like to welcome Dr. Perry to our forum. And I'd like to invite her to share with us, as an elder in our community, how has the pandemic affected her? So, community members, I'd like you to welcome Dr. Perry. Dr. Perry?
Good evening. Thank you for inviting me. I've made a decision immediately prior to coming on, and I decided I'm not here as the professional that I am, because there are people that will speak professionally on the subject, but I'm here as a senior. So I am going to take off the roles, take off the covers, and speak to you authentically as a senior that I am. When Antoine asked me to speak a couple of weeks ago, I thought, that's easy enough. I can speak. I'm feeling very confident. However, last week, I had a meltdown. I had lost a very dear friend, and I had to speak at the service of another friend who had died, both dying during this COVID shut-in period. I thought I had it together, but these deaths were really impacted me strongly. I'm a very active social media person, but I decided my emotional state needed care. So I came off Facebook. I didn't answer the telephone. I didn't go downstairs. I ate very little. And I just rested. This lasted for about 2 days. I just simply tuned out and rested. I'm not a person that's subject to prolonged depression. I consider my emotional state or health is very calm, but I experienced a meltdown, and it caused me to consider how I have been doing since the shutdown. And I have been shut in with very infrequent trips out since mid-March. So what I am presenting to you, and the person that you see now, is kind of pulling it together again. When this crisis started, I considered that I was not a person who was afraid of death. I have all my legal, financial papers in place. I declutter my house periodically. The person who's designated as my person in charge upon my death is a person I'm in frequent contact with. And she knows where things are, and we speak periodically. So these 2 deaths, along with the entire situation of COVID, really affected me in a way that I did not expect. When COVID started, I've been a faculty person in social work, so I went online, studied, and I understood the realities of who was being infected and who was dying. And I knew that I was in that population, that risk population. So I said to myself, you may not come out of this alive. And that was the way I approached the shut-in. I also was very much aware that some religious leaders and some elected officials had talked about the disposability of seniors, of Black and Latino seniors, and of gays. So I fall into all of those categories, bringing home once again that my risk was high. Like it will probably be mentioned, I have high blood pressure, I have diabetes, and prior to COVID, I have been hospitalized for a week for sepsis. I knew that if I was going to make it through this, I had to establish routine. I'm a very organized person ordinarily, but I knew that I needed a routine. I have a routine I follow every day. I'm kind of compulsive, but I added exercise. So I do 30 to 45 minutes daily. I established and started posting my blog. And I also started regular rehearsals for a play that I wanted to be in. You should know that in December last year, I turned 85 years of age. And I always have spent these last years by myself. And I use that time to reflect on the previous years, to think about what I have accomplished, what I want to accomplish, and what are some of the things I want to do before I die. So, I just thought, I'm prepared. I'm ready for this. And these deaths hit me very hard. I'm a person who doesn't mind being alone. I grew up with 8 children and 3 adults in an apartment here growing up in Howell. So for me, being alone was a luxury. And even when I have been partnered and with my partner for the past 30 years, who's now deceased, she knew that I had to have time alone. So I could go off for the day, go off for a few hours. I needed to be alone. So I had really no apprehension of being alone. I have my own apartment. I have a fairly adequate income, which means that I can shop online. My development has some stores and also a garden. I always have considered that I'm fortunate as compared to many other seniors. And that encourages me not to complain, to feel fortunate and to feel blessed and to understand that I am indeed fortunate. I'm a person of faith, so I do thank the person that I worship for the blessings that I have. With this meltdown, I had to think, so what's going on with me? what's happening here? I thought you had it all together, and I thought you were all ready for this. But obviously, I was not as prepared as I thought I was. And I had to think about my life and my time of shut in these last several months. And I looked at what was happening, what was I doing? And I realized the one thing that was probably out of routine was that I was drinking wine a little bit more than I usually do. And I have not taken wine with my meals probably for the last 20 years. But all of a sudden, I ordered from the winery and I was drinking wine. I actually talked to Antoine about this and decided that I needed to be more moderate about this. What this meltdown really made me think about, again, is the finality of my life. And I have to now go day by day. That's the way I'm doing it. This is day by day. The time is ending. And I don't know what's going to happen. So I find myself in a state of anxiety, uncertainty. And I'm going to end on just saying this. I want the hell this thing to get over. And that's it. Thank you. Thank you very much.
Thank you very much, Dr. Perry. This was really important hearing you share this, and thank you very much for sharing this, because I'm sure a number of other seniors in our communities experience like you do and feel like you do. So take a sip for me too when you do.
It's not wine, it's water.
I know. I saw. Our next presenter, community members, is one of my dear friends, Aundaray Guess. He will speak with us now about our communities now and beyond. Aundaray is the Deputy Director of the Griot Circle. His bio and all of the slides will be shared with everyone at the end of the presentation. So community members, Aundaray Guess. Aundaray?
Hello, everybody. Thank you, Antoine, for letting me be part of this conversation. And Dr. Perry, extending my condolences to you and your loss. Definitely, I know this is a difficult time, so you're in my heart always. At Griot Circle, we've been in existence for 24 years, and what we do is we provide advocacy and support to LGBT elders of color, but we're welcoming to everybody. The one motto that we have always stated is that we don't do bingo. And we say that because usually when people think about a senior organization, they think about, people coming in and just sitting at a table and sliding their bingo card and just getting ready for their next chapter. But for us, we look inside and look at the resiliency of our members, as well as how do we incorporate the past experience of our members. So with that, throughout the week, we have wellness programs in our when we were in the physical space, and these wellness programs were led by 80% by Griot members themselves. So rather than having consultants come in, we tapped into the experiences and the previous life skills of our members. With that, that really ties a lot into what's going on with COVID and our members, because again, we really promote resiliency. We also set up that independence among a lot of our members. And what this pandemic has done is it has stripped away a lot of the independence that our members were able to be, part of. So they're now in a situation where those who could do on their own, whether it's going shopping, whether it's, doing errands, whether it's going to places that they want to go, what this pandemic has done is it stripped them of the independence. So now they're dependent on others for food. They're dependent on others for, shopping. They're dependent on others just for that connection. And what we have seen so far with our members since this has started is, as previously stated, is the isolation and the depression. What the stories we've been hearing from our members is that their house, which used to be their sanctuary, is now their prison. Knowing that they're not able to now go outside and be part of that community. And also a lot of our members have expressed the loss, not of only of also friends and individuals, but also the loss of being part of the community, being able to, touch a fellow friend, being able to get a hug, the loss of touch, the loss of community itself. And so with that, we've definitely been seeing signs of depression from people who have been strong pillars, but yet, you can only take so much when you're in such a pandemic, when you don't know when it's going to end, what's going to happen next, and how long do I have to stay in this house? And like, has previously been stated with the pandemic, it has brought out so much of the inequalities that LGBT, especially people of color, have faced. Inequalities as it, relates to health. There's this perception that, it's only people of color, African Americans who are getting COVID, based on their diet or how they're predisposed to get it. My feel is that COVID and the reason why it's affecting African Americans is because it's tied to slavery. Because since slavery, African Americans have always had the short end of the stick when it comes to health and any type of services for African American, which we are now seeing exposed. I think also what we're looking at is that, there is this assumption that, unlike with our LGBT greater family, LGBT people of color have always been second fiddle. So even now the inequalities have come out where, during this pandemic, a lot of LGBT older individuals, they can go to their second home, they can escape. But for a lot of our people of color, they have to stay in their situation and stay in their neighborhood and stay in that place because they have no place to escape. And also the biggest thing also is looking at the fact that along with independence, there's even not, a thought that a lot of our members, don't have the luxury of even being in their own space, that a lot of them are renting a room. A lot of them are, in a way homelessness, but their fact they may be couch surfing. Or, again, they don't, they're in a space where it's not theirs. And so because of that, Griot Circle offered a respite for people where we had people, even though we're based in Brooklyn, we had people come all the way from the Bronx because they had to get out of that environment, out of that room where, it wasn't a affirmative place, a space for them, 24/7. But now they're stuck in that room during this pandemic in situations where it's not favorable. And lastly, with the pandemic, what it has definitely exposed is the digital divide. That there are a lot of people who are not able to connect with this thing called Zoom. Even for myself, I wasn't familiar with Zoom. So when this pandemic happened, the staff and everybody had to get acquainted with Zoom. And in addition, try to, talk our way through to a lot of our older adults who didn't even know how sometimes to save a picture when they got text. So, bringing in that digital divide, was recognition that not only do people sometimes don't have the technology or the skills, but also they may not even have that ability. So what we what we definitely started at the beginning was recognizing that we need to also create a space not to only offer programs on Zoom, but also to do programs over the phone. So therefore, people can connect still, you know, within that schedule that we had. You know, and thankfully for us, as we look forward, especially as it focuses on depression and, you know, mental health, what we initially started to do was we did wellness calls. And in these wellness calls, which happen every week with the members, you know, we started identifying mental health opportunities and relationships. And before this happened, we had created a relationship with SPOP. You know, SPOP is service programs for older people. So that was already set up where we can now, you know, at least provide those mental health therapeutic services for our members, as well as we had other opportunities, you know, such as what Carolina had mentioned was a friendly visitor program. And with that, you know, it creates opportunity for, you know, LGBT elders to be connected with non-LGBT counterparts or LGBT counterparts to have those weekly conversation, you know, just a simple matter of somebody calling and checking in on you and to seeing you okay, how you're doing, are you okay, which has such a positive effect on those who feel so disconnected from the community. So the Friendly Visitor Program is definitely has helped created a bridge for those, you know, who feel isolated, who feel like they have nobody to check on them, to feel like somebody cares how they're doing. And lastly, what we did also was we created a program called Grief and Loss. And again, grief and loss is not necessarily just about loss of individuals, but as I said before, it's about the loss of this, everything that we took for granted, I guess, you know, connected with others. So those are definitely opportunities that, you know, we definitely present to our members. And lastly, I have to say, we're still in that phase when we come to grief and depression with LGBT older adults. There's still that stigma about saying, I need help. So we haven't crossed over that bridge yet, but we recognize that we definitely have to get to a place where we have to look at the stigma of mental health, and we have to move away from saying God will fix it to I need help. So that's where we're heading now as we look at this pandemic as it continues.
Thank you very much, Aundaray, for sharing that. Our next presenter is Professor Kyaien O, and she will talk with us about elderly and alone impact on my mental health. Like I said, everybody's bios are going to be emailed as a package, all the slides that are shared tonight, including a copy of this entire video that we're doing. So community members, I'd like us to welcome Professor Kyaien O from the University of South Florida. Professor O.
Thank you so much. I'm really excited to be here tonight and hear from all of these wonderful speakers as well. Before I get started, can you all see my screen and see the slides?
Yes.
All right. So I recognize that we are running a little bit low on time, and I know that we really want to make sure we get to discussion. So I'm going to go through these slides very quickly. And as was said earlier, these are all going to be available to everyone. I had wanted to sort of start by talking a little bit about, oh, can you hear me?
Yes, we can. Yes.
Okay. I wanted to start by talking just briefly about sort of the racial and ethnic disparities, as well as health disparities that are faced by LGBTQ seniors who are also people of color, because I think what's important to recognize is that there's a history here of unfair treatment, issues with access to services, and poorer health that were here long before COVID hit. And that this pandemic has really just enhanced and exacerbated these concerns that were here for a long time previous. And this is basically what the bulk of my work has been dedicated to as a licensed clinical social worker and a professor of mental health law and policy at the University of South Florida. And this is a significant issue. We know that elders who are people of color are less likely to get preventative care, more likely to suffer from severe illness when they do get sick, have issues with access to care, and are more likely to die prematurely. And I'm going through these quickly, but I have a lot of other statistics on this. I teach whole courses on this, so if people are interested, happy to provide those references and resources for you. With regard to mental health, we also recognize, and Aundaray talked about this so eloquently, and I'm so glad that you brought up the issue of mental health service utilization. Long before COVID hit, we know that people of color, particularly people of color who are older adults and who are also LGBTQ, are significantly less likely to utilize mental health treatment from any source, despite having similar and sometimes higher rates or severity of illness. Obviously, we're a very resilient community and often have alternative sources of getting support. And Aundaray, you mentioned the church and prayer, which is incredibly important, but is not a substitute for professional mental health services once symptoms get severe. And often what happens is we see people getting mental health services in the emergency room when these things could have been addressed at the community level due to a delay in getting care early. And we know from research, and again, I have more data on this, that older adults who are LGBTQ+, who are also people of color, tend to face the highest level of disparities across the board when it comes to health and behavioral health, often due to simultaneously navigating multiple instances of discrimination based upon language, age, ethnicity, race, sexual orientation, and gender. And we also know that later life brings with it some unique challenges for individuals who identify in these populations. Obviously, I mentioned the cumulative effects of a lifetime of stigma from a variety of different parts of our identities. In addition, mistrust of the healthcare system and of the government, which can inhibit and delay people from getting help. We know that people have poorer health at an earlier age, and we're seeing illnesses and outcomes in this population that we don't see in majority white heterosexuals for 10 to 20 years later on in life. Often we see reduced social networks and social support. There's research that lets us know when we look at the population in general that older adults who are LGBTQ tend to have less children, so often have less family support around them. And that can be a significant issue when pandemic hits and there's not a lot of people in your network, especially I'm in Florida, so we've got a lot of rural communities here as well. And as I was listening to Carolina, I was thinking, wow, New York State has it together. You guys have a lot of amazing programs. We're not doing that well in Florida. And we have a pretty large population of older adults. And in the rural areas, this issue of social support is a significant issue. So yes, disparities. I also wanted to quickly say that I'm going to focus on COVID, but I want to say that I feel we're really facing two pandemics right now, and that both of these have a significant impact on the mental health of older adults who are people of color, as well as LGBTQ, the issue of COVID-19, but also the pandemic of racism, which we all know has existed, but now has sort of become front and center in the news and social media. And these things sort of hit all at the same time, which, you know, coupled together has really impacted the mental health and well-being of the population that we're talking about today. I wanted to mention, because Aundaray had a really great point about COVID-19 and the history and the connection to slavery. And I agree with you. I think there's really two things here that are important for us to recognize. And yes, COVID-19 has hit older adults harder, and it's hit older adults who are people of color harder, and people who identify as LGBTQ. But there's two parts to this. One is that historical trauma, right? So we know that the experience of slavery is a historical trauma. And research tells us that historical traumas actually attach themselves to us in our genome at the cellular level, meaning that it changes who we are on the inside. And those impacts can be seen generations after generation in younger children who never even directly experienced that trauma. And pieces of that historical trauma and legacy in our body and our cellular level, the cellular level in our genome, have also impacted the current health system, health disparities that we're seeing now, which are having a higher likelihood of underlying health conditions, a weaker immune system. We have higher health disparities, as I mentioned before, in just about every health category for older adults who are people of color, from diabetes, cardiovascular disease, hypertension. The list goes on and on and on. Also, issues of lack of access to care, lack of quality care once it's received, and bias on the behalf of the medical profession. All of those things coupled together have really increased the risk for this population. I'm going to go through this a little bit quicker here because I want to spend a little bit more time on talking about some strategies. And Carolina talked a lot about loneliness and social isolation. And obviously that's very, very important and has a significant impact on mental health. And Carolina talked also about sort of the impact on other issues as far as anxiety, depression, cognitive dysfunction, heart disease, and mortality. But also systematic racism as a pandemic. And watching the current murders of African Americans at the hands of the police force has been very triggering for many people of color. And it has triggered those experiences and feelings based upon our historical traumas that we're carrying around with us that have really just increased the need for more mental health services. So some suggestions for coping, and we've already heard a lot about some really great community level programs that are happening in New York. I'm going to be taking some of those back to my people, but just on a personal level, one-on-one level, things that you could be thinking about for yourself, your family, your loved ones. It's important to use a blend of approach-oriented coping and emotion-focused coping, where we're actively seeking to address and work through the problems that we're facing and dealing with that difficult emotion. And I say that to say that it's important that we not try to avoid it or distract ourselves from the problem or use alcohol or drugs or other methods to try to numb what we're feeling, because ultimately that just makes it worse. And for many people, that's the quick, easy fix. It's something that's there. It may work in the moment, but ultimately it just makes things worse. Obviously, we have to continue doing everything we can to prevent the transmission of the virus to ourselves and others. But it's also important to have accurate and current information, and with the caveat of not being on information overload. And so I loved what Dr. Perry said about taking a step away from social media. We have to be informed, but being inundated day after day with these horrible images and statistics and numbers and scared can really just exacerbate a lot of the problems that we're having. So we have to be aware, we have to have accurate information, but we also have to take a step back and take care of ourselves. Another thing that I found that has been really effective, and it's just a word, but sometimes words have power. So using the term physical distancing rather than social distancing, I think is really important, because we're not trying to eliminate social interaction. We're just trying to have a little bit more feet apart while we're doing it. Some additional strategies for coping that are research supported, meaning that we know that they work: exercise, prayer, meditation, journaling, talking with a friend or mental health provider, deep breathing exercises. Dr. Perry talked about incorporating a lot of these into her strategies, and it sounds like that's working for her. So this is great. You know, not only do these strategies help our emotional health, but we also know that they promote better immune system functioning and stronger health outcomes generally. So these are great things to incorporate into our lifestyle, especially since we're forced to spend a lot more time at home. Some additional strategies: create a schedule for yourself daily. Sometimes it's important to create scheduling in time for self-care, scheduling in time for that exercise. The same way that we schedule the time when we take this medication, we can schedule these personal things to do for ourselves in the same way, because often we'll get so busy in the day, we'll forget to do it. Try a new activity that you've never had time to engage in before. Try a virtual support group. They've been very, very effective. Attempt to learn new online platforms to connect with family and friends and have consistent social contact while physically distancing. Daily affirmations is really important. And one thing you can say to yourself is that, you know, it's important to take things one day at a time and not worry too much about the future, because we can't change. We can't control things that we can't change. And safely venture outside, open windows for fresh air and sunlight. It's unbelievable the impact that just exposure to the sun can actually have on our health. And then coping with racism simultaneously. A lot of those same coping strategies I said before are really important now as well, but also do things to get involved in any way that you can that are important. And one of the things I wanted to mention really quickly, just because I think it's critical for elders and people of color is the idea about sharing your story, teaching young people about your history and experiences, do your blog. It's important for people to know, some of the experiences that you've had, and they can learn from your history and your experience. I love what Aundaray was talking about with the Griot circle. Obviously, griots and storytelling is a huge part of our culture. It's a part of the fabric of who we are, and we can use that as a strategy for us now. Here are some additional resources, and just quickly wanted to make a mention that there is a online support group that is national, that is offered by the National Alliance on Mental Illness, which I'm the vice president of for the state of Florida. You can just join immediately. You don't have to register. You don't have to pay if you just want some additional support. And then this is lastly a program that I am co-producing right now. This is My Brave. Is a program that helps people share their story of recovery from mental health conditions in an effort to reduce stigma. And Aundaray, you just talked about this. This is a huge issue for communities of color. And this is one of the efforts that we're making in this area. And we're actively seeking people of color from all across the country who are willing and open to share their story of mental health, addictive disorders, and their story of recovery, because we believe that hopefully through sharing your story, you might be able to save the life of someone else. Thank you so much.
Thank you very much, Dr. Connor. This is actually phenomenal. And I know that you had to rush through a lot of what you were saying, so please forgive me. But I think also a lot of what you were talking about, we'll be able to share with our audience as part of the whole package. We are at 7 o'clock, so I don't know if there are if people have questions or comments, they want to jump in and ask. Any questions? Any comments? Anybody? Carolina or Dr. Perry or Aundaray or even Professor Connor, do you guys have any additional thoughts that you want to share about how COVID-19 is impacting LGBT people of color, seniors or elderly?
Well, for me, one thing I can share is if people really want to make a difference and really want to make an impact, call your senior family, your neighbors, connect with them, write them a letter, do anything to show that you're there for them, and that they're still part of the community. So that would be the greatest thing, that would be the greatest impact that you can make if you're asking yourself, how can I make a difference?
Actually, and one of the things that our organization we did at the beginning of April is that we launched on Facebook a Facebook group called I Am Here For You Calling 10. And what we did is use the concept of what was done in the Second World War in London, that during all of the bombing, the only thing that people had to connect with each other were telephones. And that was the way that families and friends and communities were able to stay together. And so one of the things that we thought about doing is saying, let's reach out and call somebody. I can send somebody a text. And if it's a senior who may not understand how to do a text or may not be able to respond quick enough, but if I send a text and I ask you how you're doing, you can reply back, you can reply, I'm fine. But are you really fine? But if I pick up the phone and I call you and I hear your voice, you hear my voice, we get to hear the sounds in each other's voices. And if you say to me, I'm fine, I'm like, let's try that again. You don't really sound as fine as you say you are. I'm not saying you're lying, but let's see. How are you really doing? Okay? And we start to get into a conversation. You may feel, well, I don't want to burden anybody. I don't want to trouble anybody. But no, that's why I'm calling, because I want you to tell me what's going on. And maybe by sharing what's going on, you don't feel so alone, that somebody else can hear what you're saying. And they may be able to, even if not offer a solution, but just simply to listen, to be there, and to say, well, you know what? And if the person is being honest with themselves and with you, they can say, well, you know what? I'm sorry, but I really can't. I don't know what to tell you. But I'm glad that you felt comfortable to share it with me. I'll call you tomorrow to see how you're doing. Okay? Because that gives that person that sense that I am not alone. And that is what I think is important during this time. So,
also, I just wanted to share within the Department for the Aging, we also worked very hard. Our colleague who oversees geriatric mental health in training not only professionals, but volunteers and just a layperson about the type of questions, because asking, how are you doing? It's not always effective because you're going to get that fine, and fine is not how they're doing. And so it's really about how to ask the questions that are going to, provide the opportunity to really assess what older adults are experiencing. And, many of us have highlighted the loss. It's not just the loss of people, it's the loss of the network, the community, my sense of security, what was my sense of being, of my routine and what I used to do. And so a lot of our programs also were trained in brief and how to respond regarding brief, how to even take care of themselves. Because as we know, as professionals, if we're helping older adults experience this, we're also having compassion fatigue, and we're also experiencing a lot of these challenges as professionals. And we want to be able to elicit the right information from those in need so that we can then really hear what's going on. No, I'm not fine. I haven't slept well in 3 days because I continue to have this running thought of anxiety of what's going to happen. How am I going to pay my rent? How am I going to get food? I can't go to the grocery store. The last time I went, I couldn't find some of the things that I needed. And so I think that that's really been important in part of the initiative that the department did in how to engage when we're doing these wellness calls. Really, what's the script and what are the questions that need to be asked in order to engage folks, really engage them in a conversation to honestly express how they're managing, how they're coping, so that we can really try to help and address the specific needs that are there.
Dr. Connor, can you talk to us for a brief second about fear? How is fear of one's mortality? Yes, as we're getting older, but fear now that it's become compounded because of COVID-19. And so you're thinking, should I go outside? I'm afraid to leave home. If I leave home, if somebody, breathed on me, or somebody is am I going to become infected, or what happens if I'm at home? Yes, I live alone, but now that with COVID, nobody's coming to check on me. So there's a fear also of fear of my mortality. Talk to us about that for a minute.
Yeah, so I mean, you've really said a lot of what I would say. I mean, obviously, that's fear. It's a huge impact on your mental health and well-being. Interestingly, and I don't know what your experiences are, and I've heard some other people on this call say this, that the majority of the older adults that I'm working with don't necessarily seem to talk a whole lot about the fear of death for themselves, but fear about hurting someone else or affecting someone else or getting someone else sick. I think one of the things that we've struggled with the most here in Florida is that there are a lot of people who just are not taking this situation very seriously and, would have a little bit more confidence in going outside if other people were wearing masks and taking it seriously and not getting into altercations at the grocery store because someone refuses to wear a mask and they're allowed to come into the store. So we've got these regulations that no one is enforcing. And I think for me, what's unfortunate is that it really reflects to me the lack of respect that our society has for our older population. And that in other countries, these things weren't happening in the same way because of the natural, inundated cultural value, which respects the most vulnerable people in our population. And unfortunately, I don't see that same level of respect happening in the United States. And that really angers me. And I think that adds to the fear because people don't feel like they have control over what other people are doing, and likely leads people to think, I'll just stay inside rather than take that risk. And that's a difficult thing.
And if I could just interject also, fear is actually having a direct impact on seniors because they're so fearful that they're not going to their checkups, their doctor visits. And some of them, you know, they may be feeling sick, but they're like, you know what, I'll just have to go through it, but I'm not going to the hospital, based on that fear. And that fear will really have an impact on their health if they're not following through with their continued checkups with their doctors.
I've got a comment here from I have a comment here. Help an older adult connect online. Sometimes they don't realize they can call into programs, that we need to show them how to use devices they have, or you can loan them one, or to call the local CDS center, find out if they are doing virtual programming or what services they are providing. Seniorplanet.org provides technology training specifically for older adults, which is something that actually I was hearing Carolina talking about. That in my mind, I'm thinking to myself, some seniors may not be technologically savvy or even know how to operate some things or access certain things. So that is also a fear of being, well, not so much a fear, but a sense of being left behind, a sense of not being able to keep up. And you know, if I can't keep up, then what's the point? Why bother? And so they get left out, and they don't hear about, they don't see, they don't know how to connect. And so that, you know, what can be done then, Carolina, and maybe Andre can talk about this, or even maybe Dr. Perry, who has come along, who is pretty adroit when it comes to dealing with technology. But I know that she also still struggles with some aspects of it. So how are we going to be able to get and provide that level of service for our seniors, for elderly?
So what I can tell you is that our providers, our network of providers, whether it's senior center, whether it's you know, social adult day programs, caregiver programs, case management, friendly visiting, they've also been working very hard and sometimes walking folks through the process with the technology to help clients access it, whether it's through Zoom, whether it's changing their programming, and just doing things over the telephone. We've had providers that only do activities, trivia, or plays over the telephone because the older adults either do not feel comfortable or just don't want to, use the technology. But for those who do, we do partner with Oats, Senior Planet, and they're the ones that taught 10,000 older adults in NYCHA how to use those tablets that they received from the city. So it was literally a hands-on, step-by-step guidance. Senior centers from one of our providers, Self-Help, has a virtual senior center, and their computers, and the program that's used through that senior center, it's also designed for individuals with limited technology skills, and they walk them through. So just because somebody, has the technology, is not familiar, we're not allowing that to be an obstacle to get services to older adults. Within the Department for the Aging, within our network of providers, they are doing that extra step and finding a way to engage with older adults, whether it's the telephone, whether it's walking them through and how to connect so that they can have the sessions virtually. And so that really, I think, on us, meaning us as a society and as a city here in New York City, of what we're dedicating our time to. And it's to ensure that there are no obstacles for older adults to get the services that they need, so that they can not feel fearful of technology, and that they're going to be able to, if they call 311, if they call Aging Connect and they say, I have this need, I have this issue, I'm concerned, I'm afraid, that somebody is going to be able to respond and find a way to connect with them and connect them to the services that they need. We've had a lot of caregivers who have been helped. They're not, they're in Brooklyn, and their parent is in the Bronx. And so, my mom needs to do a telehealth appointment. How do I help her? I can't help her connect. We've been able to get individuals, that can then help and walk folks through so that people can get the assistance that they need. So really, our programs have been stepping up and providing all sorts of needs, because I think that's where we're at right now, in the sense that we really just have to be flexible and realize that with the pandemics that are happening, our reality has changed, and so do our services and the expectations on us to serve older adults.
Thank you very much, Carolina.
If I could quickly say, I think also, I mean, this is new for everybody. You know, we never expected this to happen. And I think, you know, we also can still do better because we have to also recognize those who are hearing impaired, those who are blind, you know, and how do we also engage them, and how do we also give them that same technology? So that's something that we're still, even at our organization, trying to definitely address.
Thank you very much. Yes,
And
yes, Carolina.
Yeah, and just so that folks know, for the visually impaired, the Department for the Aging has a partnership and with Visions, and so we work with Visions in regards to Senior Center and also with the caregiver programs, and so they're able to also help. You know, as Aundaray said, the visually impaired and hearing impaired, they're able to really connect with these disabled individuals and help them navigate the world and help them figure out the type of programming and technology and devices, assistive devices that are needed for them to manage independently at home, now that most of them are at home because of COVID. So we also partner with Visions, and that's been a great resource for our community.
Good. Thank you very much, Carolina. Andre, Dr. Perry, I don't see you anymore. Has she disappeared and left me? But I want to thank you guys very much for hanging in here. I know it's 16 minutes after 7. Our conversation, our discussion went on a little bit beyond. So thank you again for staying with us. And I'd like to thank all those who still remained with us. I know that some people dropped off. They may have had appointments and stuff. But thank you again for staying with us. Just want to share also that I saw today that the FCC, the Federal Communications Commission, just approved 988 as the number for the suicide prevention hotline. So 988, instead of calling 911 for an emergency, you call 988 and it will connect you to someone who is who's trying to stay alive, or for suicide prevention or intervention. So once again, thank you guys very much. Let's look forward to our next event, which is next Thursday, where we're talking about COVID-19 trauma and stigma that comes with COVID-19. I heard a couple of times you guys talked about stigma and shame, but now we are going to be talking about the trauma of the experience of dealing and living with COVID-19, but then what does it look like beyond when we got to a point of some degree of stability? What does shame and stigma look like? Does it mean that when I look at you without a mask, that I will now stigmatize you or shame you? Or how are we going to develop communications again? All right. So thank you guys very much again for being here, for sharing your time with us, and thank you again. All right. Thank you.
Thank you. Bye-bye.